Everybody, we're going to begin here with a respiratory illness called RSV. It hasn't been in the news much over the past few years, due in large part to the pandemic, but it is now impacting a lot of children, mostly babies, and it's causing chaos in a lot of hospitals, simply overwhelming the staff. Locally, Oshai Children's Hospital says in December of 2019, before the pandemic, they had 181 children admitted with RSV over that whole month. Well, so far in October, they've had more than 340, with a third of the month still to go. It's caused significant capacity challenges, forcing the hospital to open 5 overflow areas for pediatric patients. And it's not just a problem here at home. The federal government says 75% of the country's pediatric ICU beds are now full.
We have not seen significant RSV over the last few years during COVID because of all of the restrictions that have been put in place. What we're seeing right now is a significant surge in COVID, more so than we saw even prior to the pandemic. What RSV does in children is in the youngest babies, it causes a viral pneumonia called bronchiolitis. And what that is mucus production within the very small airway tubes of the lungs, which makes it very difficult for babies to breathe. And so many times they can't breathe and need to come in and get some additional oxygen support, whether that be through nasal cannula in the nose, or some children do require critical care and higher level of oxygen, including ventilation. And we are also seeing an overflow of our pediatric ICU in patients who are needing that additional oxygen support. So our ICU is over capacity. The other interesting thing that we're seeing is oftentimes this affects the youngest babies the most severe. And we're also seeing some kids that are a little bit older than what we often see, 1 and 2 and 3-year-olds. And one of the reasons is they have not seen RSV before because they were born during the pandemic. And so there's no immunity there. So I think that, combined with the fact that we have maybe a potentially more severe strain, is what's causing this significant uptick in admissions for RSV.
And while a respiratory illness pushing hospitals to the limit is no strange phenomenon after more than 2 years of the coronavirus pandemic, it is important right now for parents to know that there are some differences between RSV and COVID-19, especially now that we're heading into flu season. So parents might just think that their child has a cold. It could be something much worse. So Dr. Turkovich says it's important to get your pediatrician involved if your kid is experiencing symptoms.
Really difficult clinically to differentiate between the flu, RSV, and COVID because they all cause very similar symptoms: congestion, cough, runny nose, fever, headache, malaise, that sort of thing. The only real way to know is to actually swab your nose and test for it. It's the same as a COVID test. We actually have a test here. You swab your nose once and we test for all 3, COVID, flu, and RSV at the same time. We actually are seeing some children who have both COVID and RSV. And so you can have those co-infections. But it is very difficult to determine which virus you may have just by looking at the person or the patient.
Dr. Turkovich says unlike with the flu or COVID, there is not currently a vaccine for RSV. There is an injectable antibody, but that's reserved for the most vulnerable to the illness. There is another vaccine that is in the works for RSV, but right now it's just in the testing phase. Well, we have a quick follow-up tonight to the news we brought you yesterday regarding the COVID vaccine, and an independent panel for the CDC now giving the go-ahead to put the COVID vaccine on the list of recommended immunizations. It does not mean that it will be required to attend school. Each state gets to make that decision, and here in New York, it would require a new law pass in Albany. Today, Governor Kathy Hochul had this to say about that.
That has to go to the state legislature by law, so that'll be something that the state legislature will be reviewing in consultation with our Commissioner of Health in the next couple months.
Well, currently the state requires 10 vaccines in order to attend school with medical exemptions. You can see the list there at the bottom of the screen. The CDC also recommends the flu and HPV vaccines, but you can see they are not required in New York State. So we'll see if and when COVID may be added to the list.